taking time away from looking at a patient and reading all of their nonverbals when they're sitting and talking to you and telling their story. I think that palliative care as a specialist or consultant level field kind of grew up out of necessity as those other changes in medicine were happening. And so I do think that there's a role for both specialist level and primary level palliative care that all providers can practice. Mm-hmm.
We talk a lot in like the Humanities about like doctor-patient relationships and like being personal and like really caring about them and things like that. But I feel like in this like specialty, especially, there would be like, I feel like humans have natural tendencies to like withdraw from situations where they feel themselves like getting too emotional or like whatever is going to hurt them. So how do you deal with that? And like how do you deal with your own like keeping yourself sane and like still practicing good medical humanities?
Excellent question. It's a challenge. It's a challenge, and it's something we refer to that as maintaining boundaries, not becoming enmeshed in a situation or with a patient or family. And you have to know yourself. You have to know what your own limitations are. You have to be able to recognize symptoms of burnout or compassion fatigue in yourself to be able to do that. Yes?
What do you perceive as the most rewarding thing about your job?
Most rewarding. So because of my role as a consultant, as a specialist, the day-to-day hurry through, see a patient every 12 minutes kind of thing, I'm somewhat spared from that, and I get to sit down and ask a patient or ask a parent, how can I help you? And we can talk for an hour, hour and a half, sometimes 2 hours at a time. And so we don't see as many patients, but the ability to sit and hear their story and figure out, with the help of our interdisciplinary team, what different ways the patient and family are suffering. I would say that being afforded the luxury of that time to really get to know the patients and families is my favorite part about it. Yes?
How does cultural competence and like end-of-life decision-making work, and what challenges does that pose for you?
Lots of them. There's, it's the necessity for cultural competence, particularly as it relates to end-of-life, death and dying types of situations, is paramount. And the way that I have approached it when I don't know, not sure, just unfamiliar, is through honest humility. And I will ask the family, I'll say, hey, you know what? It seems like your faith, or it seems like this aspect of your cultural background is really important to you. I don't know a whole lot about it. Can you teach me? Help me understand how I can work within your framework to provide better care and address suffering the way that you see it. Thank you, guys.